Okay, so today we're going to talk about vitamin D3. There you go, you can see that. All right, so this is D3 as cholecalciferol. Do not get vitamin D2. Yeah. Cholecalciferol is supposed to be better for absorption. However, this is, let's see, 250 is only, what's 2,000 IUs, 50 mcgs. 250%, so that's already a lot. So now here's the thing. From what I can tell, number one, get it from the sun or get it from eggs, unless you're deficient. Again, go see a doctor, get it tested. I think it's like 125 cholecalciferol or something like that in the serum, I'm not sure. There's some that are better than others, and you have to ask the doctor which one's which. I can't remember off the top of my head. But there are some measures of D3 in your body that are better than others. And only take it if you're deficient, okay? Because, a long time ago they were messing around with vitamin A and vitamin E, and some bad stuff happened. So you might want to look into that. I think D3 basically, unless you're deficient, you don't need to go get it. Some people are even saying, you have to take it with K2 or K1. I took a D3 K2 for a while, and I was worried about not plaque, calcified plaque per se, which is a whole another can of worms, but actually about calcium being stored in the wrong parts of my body, and I won't get into that. Anyways, so I was going to, they quote these statistics that, the average American is deficient in vitamin D3 and magnesium and all these things. Scary. Unless you know, and this is very unfortunate because medical testing can be expensive, but unless you know, don't try to go make it up. And it's not like anything bad happened to me, but I'm just hearing that if you take D3 alone, it could make some things imbalanced. Some people are proposing taking way more than what is necessary. They think it's like a wonder drug. I forgot what her, Rhonda Patrick, I think she recommends that. I don't know if that's very wise. I think we should be more careful with these things, especially because, like she says, it's a hormone. But, for example, they talk about things like people who die of COVID or, vitamin D3 deficient, but it's not a causal relationship. Could it be that, they're fighting off a disease, and so they became deficient? Could it be some other reason? Just because you have D3 doesn't mean you're going to be, it's helpful, but it's not the cause and effect relationship. We don't know. So anyways, you guys know how I feel about hormones. They're very strong, and they'll mess with you, and you might not get back what you're supplementing with, so you might want to not mess with that. I suggest getting from the sun 15 minutes every day if you are somewhere in the meridian, I think it is, in the middle of the, from the equator up to like something, I think it's like 36 degrees, I forget, below 36 degrees or something like that. You get 15 minutes a day between 10 and 2, and you're fine. So that's what I recommend people do. Everybody knows what it's good for. It's for, let's see, it benefits us many ways, from bone health to mood. I've never felt anything from supplementing it. I supplemented with K2 and D3 for months, and I don't think I felt anything any different. In fact, the calcium I was talking about before didn't make a difference. Okay, most people are not deficient in vitamin D, but they do have optimal levels of vitamin D. La la la. How to take it. Okay, so risk of falls, parathyroid, colorectal cancer, asthma attacks, blood pressure, body fat, all sorts of things. Mayo Clinic, don't really have very much time. So I think I'm just going to leave it at that. You guys can look up what it's good for. That's just basically my experience. Don't buy it unless you absolutely need it, and get pharmacy grade from your doctor. I'll see you guys next week. Remember to like, subscribe, and tell your friends.